Presentation. This was an overview of refractive procedures which we use in eye. See, the radial keratotomy is now the past. It was used for a few decades, but the problem is that the incision in the cornea leads to weakness of the cornea. The ocular integrity is jeopardized, and trauma, maybe after 1 year or after 5 years, can lead to rupture of the corneal scar. So it is now no more used. Instead, we are concentrating on the LASIK and PRK. See, the other problem with radial keratotomy or arcuate uh, incisions are that you can go full thickness and lead to corneal perforation, and this can lead to infection, uh, or you have to apply sutures to close the wound. As far as refractive surgery is concerned, before going for refractive surgery, we exclude a few conditions like keratoconus. So, uh, what are the different indices in the corneal topography which we use to rule out keratoconus? Good KPI, uh, and central corneal thickness, okay. Right, okay, fine. What is bad? In KPI, there are different indices which are combined together so that it is more reliable. So instead of only concentrating on the superior inferior asymmetry or corneal asymmetric points, in KPI, about 8 or 9 indices are combined. Similarly, Bellon Ambrosio uh, ectasia. This is the latest graph which tells us that is there probability of keratoconus or not. So just remember the name of BAD. So coming back to LASIK, which is now the most popular uh, sort of uh, procedure now done. See, I would like you to describe one or two procedures and in detail so that you know what are the contraindications and what are the complications. See, instead of let's say visiting so many procedures, you see, dry eye is a big problem after LASIK surgery because they say that the corneal nerves are cut, and this can lead to decrease in the tear production. Now, this is a controversial subject. If you search on the net, you will find many reports of suicide after LASIK. See, the people who are against refractive surgery, they have uploaded so much of the data that so and so committed suicide because he or she could not sort of bear the dryness and could not sort of adapt to the lifestyle of putting a drop after every 15 minutes or so. But on the other hand, the other side gives arguments that the suicide rate of the LASIK people is the same as the suicide rate of the normal population. So there is no difference in the two. So it means that the LASIK or the procedure is not adding to the suicides. So this is a great debate. Anyhow, we should remember whenever we ask, sort of prescribe the procedure to a person, we do mention the side effects and the complications which are posed. So this is part of the informed consent. So whenever we take consent for any procedure, we describe the advantages and the disadvantages the patient is likely to face. So now I would like that in some future lectures you also describe smile. What is smile? Right. So this is the latest sort of modality in this series, and you see, PRK was done previously after removing the epithelium, but now we are doing we do trans uh, PRK. So we do not remove the epithelium, rather we apply the laser and uh, so this one step has been shortened. As far as LASIK is concerned, we can do the superficial corneal flap with femtolasic or with uh, keratom. So each has got its own complications. There is danger of infection, uh, displacement of the superficial corneal flap. Uh, Infection can occur at the interface between the two layers, and you see, the graft can dislodge or the graft can uh, be displaced um, after long time also. You see, this corneal strength is never same as that before the procedure. So the corneal strength is compromised after. And if you leave a small bed, uh, mm, less thickness of the cornea, it, there can be ectasia. So what is ectasia? Thinning and bulging. So you can see that the patient complains of increasing power of the cornea after a few weeks or months. So the cornea starts bulging out, and then it is difficult to manage such a patient. हाँ जी ऐड करें आप एहसन साहब जाहिद साहब कोई आप तो करते रहते हैं माशाल्लाह कॉर्नियल रिफ्रैक्टिव सर्जरी में
ऑप्सलेट वन जो होती है आर के कॉर्निया को बहुत वीक कर देता है इवन सम स्टडीज उसमें ये है कि ये लेस